Dr. Sender, can you talk to some of the medical challenges that you deal with today and the advancements that you made? And we've talked on fertility. You know, that's one of the things that really kind of pops into my mind. I think in my early days in my nursing career, you know, we really didn't talk to patients about fertility. So what are those key issues that we've seen advancements around that we're able to give young adults, you know, a different life and a different outcome than we were able to?
Well, clearly fertility preservation needs to become central to all adolescent young adult medicine. You know, actually my editorial's going to be in the journal is going to be about, I call it the right to choose. Women have a right to choose one day if they want to have children or not. And if that's the right, and we believe that survivorship really begins on day one, then we really need to address that issue right at the beginning and stop what we're doing now, which is only a tiny percentage of the women are being offered either egg preservation or embryo preservation or ovarian cryopreservation.
Still today?
Still today. So ASCO has guidelines, but the reality is most places don't do it. So one of the things we need to do is start a movement, if you will, that says to every cancer hospital, before you start the chemotherapy, have you checked off that you've looked at preservation, whether it be male or female. And not every patient needs it. Not every patient can get it because of the circumstances, mostly medical. But we need to address it. So I think that we made advances, and I think Fertile Hope and then what Lance Armstrong Foundation did and financial support has helped. We got it through WellPoint. WellPoint now will pay for egg harvesting for patients, which is 38 million subscribers to WellPoint, which makes it one of the largest insurance companies. We're making progress. So to them, it's like we have options. We need to tell them about the options. So it breaks my heart when I hear as an oncologist and I get called that someone hasn't been offered that, and they're coming back. And if you come to the critical mass meeting, or you come to the Young Adult Alliance in the past, or to Stupid Cancer, and you talk to people in their 20s and 30s who had cancer, and they're the survivors, and they're irritated that they weren't talked to. My pediatric colleagues don't do a great job. They always say it's not necessary. We don't need it. We need to do it. We just heard in today's meeting that about 20% of them, males, may have no sperm. You can't use the chemos that we had in the past. So I think it needs to be partly, and in a way it's a great conversation piece because it allows you to start talking about all the psychosocial issues that Heidi and everyone talked about. But to me, I say it's a right. It's a fundamental right of anyone to make their own choice. Don't make the choice for them. And we as healthcare professionals have to assist them, because at that moment of crisis when they've been offered 12 protocols and treatments and everything else, they really can't make that decision totally on their own. So we've got to help them make it now, and then future planning to say whether they need to use it or not.
I was just going to add, I think this brings up another important kind of unique dynamic for young adults with cancer, which is, I can say that actually one of the oncologists I met initially when I was diagnosed talked about fertility with me. But my parents were in the room, okay? I think there needs, and I would hope there's a greater level of sensitivity after all these years, but the notion that I think it's up to young adults to some degree to demand and say, what are the appropriate conversations for, whether it's my parents or my spouse or whoever it might be in the room and to really take control of that. And that certainly speaks to Selma's focus on cancer communications. This is not just about us communicating as a community. It's about helping you to be empowered to better communicate with your providers.
So just to add to that, because I just think Thelma was, I think she's the start of the movement called patient-centric care. Because she was one of the first people to tell the healthcare professional, you need to put the patient in the center. You really need to understand and talk to your patient. And that communication, she said, the many conversations I had were really about how do we talk to these patients.
You need to be prepared to have that conversation. Like she didn't let you off the hook as, it's all in the doctor,
We've come up with the term planned patienthood,
And I'll just add, a real life example. The dialogue, I don't think it was happening more in a vacuum, and it's bringing the advocates and the patients and the clinicians and the researchers all together. And I know she was a huge advocate of that. But 10 years ago, our organization, we work at some of the top hospitals in the country, with navigation programs there. 10 years ago, the conversations we had to work with them, to walk in the door, weren't even received or accepted. And now there's invitations and there's institutions starting their own AYA programs. And that's just phenomenal. And that's because the dialogue is no longer in a vacuum, it's happening collectively.